Good afternoon, and this episode from the New Hampshire Insurance Department is about a medical provider up in the Lakes region. Specifically, he was a chiropractor and had been in business for quite a while. And a New Hampshire consumer was reviewing their EOBs, and if you don't know what that is, it's called an explanation of benefits. And they noticed a tremendous amount of chiropractic visits that they had not attended with this chiropractor, and they thought, well, that was kind of weird. So they reached out to their carrier, who was Anthem, and say, can you give us a copy of all the medical records and any billings that you have associated with me and this chiropractor? And what she ended up finding was about 30 plus visits that she supposedly had with this chiropractor that she knew she had not had. We received that referral and we opened a case on it, and we drove up to visit with the doctor and ask a few questions. When we got there, we found out that it's a one-man show. He does all the services to the patients, he does all the billing, he does all the administrative work, he does everything. We started asking him a couple questions about billing, and he said, well, the way it works is I take a blank piece of white paper and I write down the name of the patient, the date I did services, what services I did, and I send them to this company in Rhode Island. That Rhode Island company actually fills out the claims form, sends it to whatever carrier it might be. When they receive the money back, they keep a portion for their trouble, and then they send me what portion I'm supposed to receive, and that's the way the system works. We thought, great. We didn't know exactly who had done anything wrong, if anyone had done anything wrong yet. So we drove down to Rhode Island. And we met with that billing company, and they were very, very cooperative, and they shared with us all the records they had received from this doctor. That led us to want a little bit more information from Anthem. What we asked for specifically was all the records they had for this particular New Hampshire consumer, and we also wanted a spreadsheet of all the other members that they have that sought services from this chiropractor during a very specific period of time. And why did we want that? Well, if we ever got a chance to review this doctor's medical records, we could compare the spreadsheet of billings that were sent to Anthem versus what the medical charts would actually show. Of course, he would not just openly show us medical records, so we did a search warrant. We went in and we started scrutinizing every single medical record and bouncing it against the spreadsheet, and found 25 other New Hampshire consumers whose records conflicted with the spreadsheet sent to us by Anthem. We approached the doctor and said, it looks like a lot of your medical files are missing lots of documentation. How do you remember, or how do you know what services you provided to a particular patient if it's not in the patient's chart? Pointed to his head, he goes, it's all up here. And that's alarming. We started looking at it a bit more. It began to spider web. We found more victim consumers. We found more victim companies. And at some point, understanding that the New Hampshire Insurance Department works closely with the Attorney General's office, and that's where the Medicaid fraud unit is located. They may have a component as well. We packaged up our case, we gave it to the Attorney General's office. Ultimately, the New Hampshire Attorney General's office prosecuted the case, and the gentleman pled guilty to one count of felony insurance fraud, and he also voluntarily surrendered his license to practice in the state of New Hampshire. To report insurance fraud, email nhfraud@ins.nh.gov, call 1-800-852-3416, or visit nh.gov/insurance.